We are going to get started with today's meeting. And I want to say hello and welcome. My name is Dr. Diana Ramos. I'm the California Surgeon General, and thank you so much for joining us for the first Strong Start and Beyond webinar. This will be a series that we're going to be holding every month on the first Wednesday of each month at noon. The goal of this webinar series is to provide updates and highlight details informing Strong Start and Beyond. We will be implementing multiple communication modalities to share our updates, as well as resources, and more importantly, to amplify the voices and contributions of our partners. We look forward to engaging with each of you as we work together to make significant strides saving the lives of mothers. Today's webinar is a summary presentation of the Strong Start and Beyond movement. This was launched on September 17th. You will have an opportunity to ask questions using the Q&A function. Responses will be provided as the questions come in, and we welcome one-on-one conversations beyond today's webinar. Please reach out to Strong Start and Beyond at osg.ca.gov. The session is being recorded and will be available on our website next week. So let's get started. As I mentioned, Strong Start and Beyond was launched on September 17th, just a little bit over a couple of months ago. And we are excited to share what the whole program, the movement, is all about. Can we have the next slide, please? The importance of really focusing on maternal mortality really speaks from the data. The data drives the action. And we can see that the pregnancy-related mortality ratio in the US and California have significantly increased since 2013. As you can see here, from 2013 all the way up to 2020, the US pregnancy-related maternal mortality ratio was 24.9 per 100,000 women. And that in California was 21.6 per 100,000. Now, a significant factor for those increased number of maternal deaths, pregnancy-related mortality ratio, was due to COVID. So if we were to exclude the COVID deaths, our maternal mortality ratio would be 12.6 per 100,000. So we can see that COVID played a big impetus in increasing the pregnancy-related mortality ratio in California. And now, as an obstetrician gynecologist, taking care of pregnant moms is a critically important responsibility, because we know that when we save the life of a mom, we're not just saving the life of a mom, but we're saving really the whole family structure, because everyone within the family is impacted, from that newborn to the partner, as well as the children that may be at home. So it really is an opportunity to help improve the lives of more than just the mom, but really families in California. So with that, we realize that this is an opportunity for us to step up. As you can see here, California has the lowest maternal mortality ratio, and we're going to see this coming up even more. But we have the lowest maternal mortality ratio in the country. But as such, similar to the rest of the country, the deaths have increased as a result of COVID. Can we have the next slide, please? This slide summarizes the impact of COVID, and you can see that in 2020, there was a rate of pregnancy-related deaths that increased 45%. Also in 2020, 24% of the pregnancy-related deaths, and these are specifically in California, were from COVID. And in 2021, 71% of the pregnancy-related deaths were from COVID-19. So again, COVID played a big factor in increasing the pregnancy-related deaths in California. Next slide. So with that in mind, oftentimes the question is asked, well, who are the people that are having the babies in California? And then more importantly, where are the pregnancy-related mortalities occurring? And you can see that in California, 49% of the births are to Hispanic moms, 29% to white moms, 16% to Asian, 6% to Black, and 0.4% to American Indian and Alaska Native. So this is the big breakdown of who's having babies in California. But you can see here on the map, the dark blue are the areas in California where there is a higher rate of pregnancy-related maternal mortality ratios. And some of those are very urban areas, like in Los Angeles County. But as for those of you who are in Los Angeles County will know, there is a diversity of geographic regions and access in Los Angeles County. And then you can see the rest of the breakdown in California. Can I have the next slide? So we can't overlook the fact that disparities by community conditions, such as social determinants of health, play a big impact in terms of the communities where moms are dying. And there is a 2.1 times higher rate of pregnancy-related deaths in people where they were living in the least healthy community conditions. And the Healthy Place Index is an amazing resource that is available online that you can put in your zip code, and it provides down the social determinants of health profile in those in the community that you put in. So I invite folks to put in their zip code on that healthyplacesindex.org website, and you can see what the social determinants of health are like in your community. But again, just highlighting the fact that the higher the social determinants of health, the higher the correlation of the pregnancy-related deaths that we're seeing. Next slide. So in looking at the pregnancy-related maternal mortality ratio by race and ethnicity, we can see that from 2013 through 2021, the breakdown of the Asian, Black, Hispanic, and white maternal mortality ratio deaths. A couple of things to really look at is the disparity in the Black population. In 2013, the disparities, there was a higher pregnancy-related mortality ratio in the Black population that was 5 to 7 times higher than the other groups. And that pretty much remained steady. We're now down to 3 to 4 times higher rate of Black pregnancy-related deaths in 2021. The one thing that we can't overlook, though, is the fact that the maternal mortality ratio has steadily increased in the other ethnicities. In the Asian, it went from 12.2 per 100,000 in 2013 to 14.4 in 2021. In the Hispanic, it went from 8 to 17.7. So deaths. So that doubled. The total number of deaths doubled from 2013 to 2019. You have to remember that in order for there to be the proportional higher rates, you would have to have then more maternal deaths, because the Hispanic women had a 49% total births in California. But by absolute numbers, the total numbers of deaths in Hispanic moms has doubled since 2013. And then in the white population, the pregnancy-related maternal mortality ratio went from 10.2 in 2013 to 14 per 100,000. So again, the deaths are steadily increasing. And in the Black population, from 2016 to 2021, it has more or less remained steadily the same. But still, the overall takeaway is that it's 3 to 4 times higher than the white population when you look at the proportionate number of deaths and births. Next slide. So all of that being said, it just really drives the impetus for focusing again on reducing maternal mortality in California, specifically focusing on the ethnicity initiatives. And the time is now, because you may or may not be aware that there is a White House initiative that has a maternal health blueprint focusing on decreasing maternal mortality. You probably have heard the headlines that living in the United States, depending upon your ethnicity, your probability, your risk of dying could be that of in the deaths that are seen in third world countries. HRSA has come up with the year of 2024 as enhancing maternal health. The CDC has recently released their maternal hypertension and behavioral health initiatives. They've just recently released their update on the pregnancy hypertension change toolkit. And the first partner of California, Jennifer Siebel Newsom, is leading the way with the California for All Women. So all of these initiatives have really aligned so that we can elevate the focus and the work that we want to do to save new moms, to save the lives of moms and improve the lives of families by decreasing maternal mortality. Next slide. So we want to share a video that highlights some of the voices that are really driving the work that we're doing. The why. Why is this even important? It's important because, again, we want to save the lives of moms, but there's nothing more powerful than to hear those who have unfortunately suffered a loss in their families. Can we play the video, please?
Family is mourning a great loss while also celebrating the birth of a new baby. 19-year-old Ariana Sanchez died due to complications while giving birth to her daughters. The father, Ezekiel Esparza, says he still remembers the day he and Ariana found out that they were going to be parents.
But she was telling me, she was like, the line's not going away, babe. The line's not going away. She's the love of my life.
Once known as the world's fastest woman, Bowie died at her Florida home from complications of childbirth. The tragedy is resonating deeply with Black women who are at higher risk of dying while pregnant.
The circle of life begins with the birth of a child, and that journey begins with pregnancy. People who are pregnant or who have had a baby know their bodies and know when something does not feel right. When they speak, we must listen.
So it's wanting to create that change, wanting to address those voices that we just heard and realizing, can I have the next slide, please? And realizing that we need to address this as a community, as a state. And so with that, we put out the California Maternal Health Blueprint, which is the framework that builds upon the work that has already been started and has been ongoing. It builds upon the work that is being done by the California Department of Public Health, as well as the California Department of Healthcare Services. It is meant to be a starting point, and it is not meant to be an end-all, be-all. Quite the contrary, it is the framework for which we are building upon to improve the health of moms and the lives of moms, and making sure that every person in California has an opportunity to raise their child. So with that, the goals of Strong Start and Beyond are simple. Two things: reduce maternal mortality 50% by December 2026. We know that this is a big, audacious goal, but it is only through big, audacious goals that we will push ourselves to accomplish something so wonderful as really saving the lives of moms. This is not something that we take lightly. This is a big responsibility, and the only way to be able to do that is collaboration and partnership. And the other big initiative of Strong Start and Beyond is to educate and empower individuals on their reproductive health. And what do we mean by that? Oftentimes, people feel that they are not being heard by their provider. They're not being listened to. There are issues they want to talk about, but unfortunately, the opportunity is not there for them to start that conversation, or they oftentimes, we hear, don't know how to start that conversation. And with all of that in mind, our hope is to be able to provide resources, highlight work that is already ongoing in California that provide that framework for people to be able to have that voice with their healthcare. And there's a lot of amazing work already happening from Fresno to the Central Valley to Southern California on resources and tools to be able to have that voice, have that opportunity to be an active participant in their health. Next slide. So when we look at what the causes of pregnancy-related deaths are in the United States, you can see that nationally, 23% is related to mental health conditions. That includes suicide and overdose. So this is nationally. 14% due to hemorrhage and 13% due to cardiac and coronary conditions. More recent CDC data highlight the fact that depending upon your ethnicity, that cause of death may be different. We know nationally, the CDC in April highlighted the fact that it is cardiovascular disease that is the #1 cause of death for Black moms. It is emboli that is the #1 cause of death for Asian moms, infection for Latina moms, and for white moms, it is suicide and overdose of mental health conditions. So depending upon your ethnicity, that cause may be different. That's nationally. Can we go on to the next slide? In California, it's quite different. The #1 cause of pregnancy-related causes of death is heart disease, and that is for all ethnicities, for Black, Asian, Hispanic, white, for all ethnicities. So 23% heart disease. And then following up are bleeding at 14%, behavioral health at 12%, infection at 12%. The one thing to highlight is that caveat highlighted in yellow, that behavioral health causes are associated with 10 to 15% of all pregnancy-related deaths from medical conditions. So there was a component of behavioral health in heart disease and bleeding, infection, along with that primary cause of death. So again, just highlighting the importance of taking into consideration the behavioral health component of the reproductive spectrum from preconception to postpartum. Next slide. So keeping in mind that the most common cause of pregnancy-related deaths in California are cardiovascular, I want to highlight some of the key components from the consensus statements on Alliance for Innovation on Maternal Health, the consensus bundle on cardiac conditions in obstetric care. And the reality is that most people who died from cardiac conditions during pregnancy or postpartum were not diagnosed with a cardiovascular disease before death. So they had an underlying cardiovascular disease before they even became pregnant. More than 80% of all pregnancy-related cardiovascular deaths, regardless of the cause, were preventable. So this is a call to action. Again, realizing that in California, cardiovascular disease is the most common cause of pregnancy-related death. The onus is on all of us to really not only do our own piece, but educate and help support pregnant moms as well as the postpartum moms to address this issue. And most who died had an underlying risk factors and had presented with signs and symptoms suggestive of cardiac disease. So again, that feeling of I'm not being heard, or I need more help, or something's just not right. So that opportunity for us as healthcare providers to perhaps stop and listen to our patients, and just to be a cross-collaborative partner to elevate the fact that cardiovascular disease is critically important, and we all have a role to play. And we're going to go into more details on that. Next slide. Other highlights are that cardiovascular system conditions that may affect maternal deaths include congenital heart disease, and there are acquired heart disease in pregnancy conditions that are up to 12 months postpartum. And these include cardiac valve disorders, cardiomyopathies, arrhythmias, coronary artery disease, pulmonary hypertension, and aortic dissection. I want to bring to your attention that the CDC released last week a report highlighting how cardiomyopathy was the number one cause of cardiovascular disease during pregnancy and postpartum. So I invite you to go to that report that was just published last week, again, highlighting the importance of addressing cardiovascular disease. Next slide. So reminding us, in California, over 80% of California maternal deaths are preventable. We can prevent a mom from dying. So it's not just that the deaths are preventable, but it's also remembering that over 80% of the cardiovascular deaths are preventable. So we have an opportunity to save lives. Just by even looking at the data, we now have awareness of where our opportunities lie. Next slide. Critically important to remember that 1 in 3 women of reproductive age have at least one chronic condition. And you can see here what the chronic conditions are. The latest data from that CDC report last week highlighted that 1 in 5 women had an underlying cardiovascular disease. So whether or not that is diagnosed, sometimes people know, sometimes they don't. Next slide. So for those who do know or maybe are not sure of what their reproductive decisions are, it's really important to highlight that there are contraceptive options available, and educating ourselves and knowing where to get the information to make the best informed decision and to know our options is critically important. So I invite folks to go to our website at the California Surgeon General website, and we have some resources there on information on contraception options to help people plan if they're ready to become pregnant, or if they're not ready to become pregnant, what would be the best method for them. And that's all done in discussion with their healthcare provider. And just start out by knowing what your options are and what is best for you. Next slide. And we cannot forget that pregnancy is truly a window to future health. And what do we mean by that? Oftentimes people think, I'm pregnant, and once I've delivered my baby, whatever medical conditions I had, they're now resolved. I hate to break the news, but that's not what happens. If somebody has had high blood pressure in pregnancy, there is a 63% increased risk of future cardiovascular disease. So that's critically important to know. So just because there was preeclampsia or gestational hypertension during pregnancy, it's important to keep in mind that there is a higher chance of cardiovascular disease in that person's future. If there was diabetes, there's a 20 to 50% chance that that person will develop type 2 diabetes later in life. And depression increases the risk for suicide. So depression in pregnancy. So really critically important to make sure that we remind people that because there was a complication a medical complication in pregnancy, that it's critically important to keep that postpartum visit so that the health issue that presented itself could be addressed and then followed, and more information could be obtained as to how that health condition could impact the rest of their health, the rest of their life. Next slide. So keeping in mind that 80% of health happens outside the healthcare setting is so critically important, because we know that really it's only 20% of that clinical care that makes an impact in a person's health. As an obstetrician gynecologist, I wish that it was my visit with the patients that I saw that made that big difference, but it really wasn't. It was the health behaviors that were happening outside of the healthcare setting, and that's 30%. It's the social and economic environment that provides a 40% impact on that driver of health. and the physical environment. So all of these things combined really drive what health looks like for an individual person. The other big overlying factor that is also a social driver of health is racism, structural racism, and that comes into play into all of the social determinants of health. And we know that depending upon the person's background, depending upon where they live, their zip code, the outcomes are going to look very different. And that's where the opportunity lies for all of us to work cross-collaboratively to elevate those programs that are working well, especially in those lower resource communities, so that we can help everyone in similar communities address those needs. And that could be folks that are American Indian, Alaska Native, the Black population, the Latino population, Filipino, whatever that ethnicity is, but we want to make sure that everyone has at least an awareness of programs very serving groups very similar to the groups that are maybe in other parts of California, so we can cross-collaborate best practices. Next slide. So with that in mind, we thought and we heard from some of the people that we have had as advisors, as well as some of the community people that we've had conversations with, what is it that really is important to know? And one of those things is just reframing about how we think of health. What do we mean by that? Well, you don't want to start to think of health when you're sick, right? We want a preventive, proactive approach. And one of those best examples of just reframing and changing the narrative of how you think of things was the Cosmopolitan quiz that the Cosmo used to be in print, but there was a quiz every month. And this was an example of one. Is your best friend really on your side? And you start to answer the questions, and based upon the responses was the general recommendation. Was it truly a recommendation? No, it wasn't, but it was just a way for you to think about your best friend. And these were oftentimes, I know I completed it in the supermarket check stand as I was waiting to pay. I'm like, okay, what's the Cosmo quiz? So we just are wanting to do something very similar to that, just changing the narrative of how we think about health. So with that in mind, we came up with something called PRIMA, Preconception Medical Assessment. And it is not final, and it is a draft. And PRIMA is a quiz very similar to the Cosmo quiz. The intent is for it to be completed outside of the healthcare setting, not to be shared with a healthcare provider. And the answers are to be kept by the person that completes it. Do you have to turn it in anywhere? Absolutely not. It's similar to those Cosmo quizzes that you just answered the questions and you just started to think. So the PRIMA quiz takes into consideration the highest risk medical conditions that could lead to complications. This is specifically focused on medical. It is not focused on depression screening because there is a validated depression screening tool out there already. So this is focused on the medical portion of it. Really, the recommendations right now, and this is what is being finalized, the recommendations are pretty much the same for everyone. And that is having a preventive care visit with their provider, knowing what the contraception options are. And if you're not ready to, if you're not ready to become pregnant or get pregnant, what are your options? What do you want to be able to speak to with your provider? And then if there's medications that are being taken, think about the fact that, well, maybe some of those medications may cause birth defects if you were to become pregnant, and this may be an opportunity to speak with the provider to be able to review those questions. It's very basic, very simple. The intent is for PRIMA to be put in the laundromat as a one-pager, to be put in the supermarkets, in churches. Again, it's just changing the framework of how we think about pregnancy. I can tell you as an OBGYN, when I would oftentimes see patients for the first time for their prenatal care appointment, I would oftentimes say, wow, you're on medication that could perhaps be teratogenic because of your health history. That you may be a high risk pregnancy. That's not what they wanted to hear, but I would oftentimes hear them say, I wish I would have known, I wish I would have thought about maybe getting that exam before I became pregnant. And this is all that Prima is intended to do. It's just changing the narrative of when we think about our health. And if there's something that can be done proactively before pregnancy, then that would be the time to perhaps start to think about it. The resources as to where folks would be directed right now are a very high level, because this is not intended to be an immediate and end-all solution for resources. Very high level. Right now, the governor's office has come out with a website, ca.gov, that is very high level and directs folks to social determinants of health resources, as well as Medi-Cal health resources, very high level. There's also a website, findhelp.org, that provides resources on a national basis. And you put your zip code in, depending upon where you live, then you're going to get information for health as well as social determinants of health support. But the other opportunity that we'll be inviting folks to is to put their resource on that page. So if there is a community organization that wants to direct folks to their organization, absolutely, by all means, please add it in there. Prima is meant to be an open source document, meaning that please use it. And it's, again, just a resource and a tool to change how we think about health. The information is not to be shared. The information is strictly for the person completing it. Can a partner complete it? Absolutely. If they know that the medical history of that person, yes, you can complete it, and you can be the one initiating the conversation with your partner. And we've had some organizations, some partners that have said, wow, this is something that the dads can complete. And I can easily get dads to complete the Prima for their partner so that they can have that conversation. So Prima, if I can have the next slide, is based upon the Obstetric Health Index. The Obstetric Health Index is a validated inpatient assessment, or actually a checkoff, that predicts whether a patient is going to need an ICU admission or a C-section. It is, again, just focusing on the highest risk that is going to need the highest intervention. So we took those 20 questions that are in the OB Health Index and created it into a simplified 7-question Prima quiz. So that's where the questions came from Prima OB. The OB Health Index is validated, is being used in India, in Canada, as well as in Finland. It's being used at the Cleveland Clinic and several other hospitals in the United States. So that's where Prima came. So again, Prima is self-initiated. You keep your scores. Don't share it with anyone unless you want to. And it's just a way for folks to start thinking about their health before they become pregnant. Next slide. So in terms of the pregnancy-related deaths by timing in California. So this is another critically important piece. Remembering that 80% of health happens outside of the healthcare setting. It's critically important to realize that 62% of the pregnancy-related deaths occur after delivery, after a baby's born. Now, this oftentimes goes contrary to what we think, and that is that the deaths are occurring during labor, the deaths are occurring during pregnancy. Quite the contrary, 62% are occurring after the first day of delivery. The majority of the deaths are occurring the first week after delivery. Next slide. So why do we bring it up? Well, we bring it up because depending upon your ethnicity and your cultural observances, there may be some observances that limit people from going out. And if we keep that in mind, I can tell you in the Latino population, we have what's called a cuarentesma, meaning that you stay home for 40 days. In the Chinese population, you stayed home for 100 days. And so with that in mind, it's important to realize and to look, when are the moms dying. And by looking at their ethnicity, the Asian moms, 69% are dying 0 to 6 days after having a baby. So keeping in mind that if a person is observing the Chinese tradition of staying at home for 100 days, wow, are they going to be going to that postpartum check? Are they going to maybe be taking the baby to that peds visit, or is it going to be somebody else? But just it just helps set the framework of opportunities for us to be there for the moms. In the Black population, you can see the breakdown that the majority of deaths are occurring, 37%, 0 to 6 days. Hispanics, 47%, again, 0 to 6 days. Pacific Islanders, 55%, 0 to 6 days. And the white population, 49%. So that first week is so critically important. And I bring that up because oftentimes if there was a high blood pressure, preeclampsia, cardiovascular condition, the recommendation is to follow up within 7 days, generally 7 to 10 days maximum after delivery. And if moms are missing that appointment, you can see where the majority of the deaths are occurring. So it could be something that can be done in the community, could be as simple as reminding moms, don't forget to keep that postpartum visit. Do you need me to provide a ride to take you to that visit, or do you need me to watch the baby while you go to that visit? So again, the looking at the timing of death provides opportunity for us to support the mom. The other thing I want to highlight is the timing of death for 43 to 365 days. And you can see that the Black moms are dying the most, 24% after 43 days. So what does that mean? Again, just opportunities to make sure that we have and take advantage of every touch point with moms, especially with the Black moms, looking at the 24%, to be able to remind them, how are you feeling? How is the baby? Remember, cardiovascular disease is the number one cause of death. And if somebody is complaining of a headache, complaining of shortness of breath, complaining of chest pain, not dismissing it and saying, you may want to get somebody to check you out and make sure that everything is okay. So this is the reason why it's critically important for us to look at that timing of death. Next slide. So with over 80% of health care occurring outside of the healthcare setting, Strong Start and Beyond is really pulling on increasing awareness of health, changing that narrative through the PRIMA questionnaire on what impact your health can be before you become pregnant. We want to improve awareness of resources that are available, not only to access health, but social determinants of health. We really truly want to support the behavioral health because we see the importance of the impact on behavioral health on all moms. And we saw that 10 to 15% of all medical conditions are impacted by behavioral health. And truly highlighting that partnership and collaboration, so critically important to be able to support moms, to be able to encourage people and get the medical care that they need, and then more importantly, be part of that journey as a new parent. And for those of us who have had children, you know how physically exhausting it oftentimes is. And I was on a panel, a webinar not too long ago, and there was a single mom that was Thai, and she shared how she was alone and she was so exhausted. She was crying, she was sad. And it wasn't until the neighbor came over and said, how are you feeling? Can I sit with the baby while you take a nap? She said, that was the best gift. As something as simple as that, that was the best gift that anyone could have given me, that little bit of support for me to just take that 1 hour nap. So it's important that we don't overlook the little things that truly make a difference in the lives of new moms. Next slide, please. So moving forward, we have, again, that big audacious goal of reducing maternal mortality by 50%. And we have other big goals that are going to get us there to that 50%. And one of those, the hope is to launch Prima by the end of December, which is next month. Now, as the closer we get to December, it looks like the timeline may end up being moved, but we're still going to strive for it. The other thing to bring awareness is that in February, we are going to be highlighting and elevated a lot of resources that are focusing on cardiovascular disease. We are partnering with the American Heart Association and several other partners to really help us address not only amongst the community, California in general, but with healthcare providers on the importance of addressing cardiovascular disease. Mental health, behavioral health focus will be in May. And really that's going to be focusing on the fourth trimester, what happens after, because remember 62% of the deaths are occurring after a baby is born. And then we're going to be moving into the hospital focus. We're waiting for the hospital more towards the end of July of next year, because the hospital systems have already incorporated a lot of the resources, the toolkits, the algorithm that have helped California have the lowest maternal mortality rate in the country. And then finally, in October, 1 year after our launch, we are going to look to see what worked, what do we need to do better. But all along this whole timeline, we are incorporating, we are asking, and we are elevating the resources from the community, from all of the ethnic, geographic areas throughout California, organizations to elevate the work that are going to get us to that decreasing maternal mortality by 50%. Again, this is not something that we can do alone. It truly is through cross collaboration and highlighting the fact that the California Department of Public Health, the California Department of Healthcare Services, many other nonprofits and partners throughout California are already doing the work. We want to break down the silos that oftentimes we get too comfortable in and build cross collaboration so that together we can have a better outcome and reach that maternal mortality ratio that we want to strive for and decrease that maternal deaths by 50% in California. Next slide. So with that, thank you so much for your attention. And we ask you to please partner with us, because again, this is not something that we are aiming to do alone. Quite the contrary, we are aiming to do this in collaboration and partnership with all of you. And depending upon the group that you are representing, that is going to look very unique, very different. We're going to have a lot of other communication modalities that are going to provide an opportunity to elevate the voices of all of you and some of the amazing programs that we are doing. We're going to do that through newsletters and many other multiple modalities.